So this video, we're going to show you how to test two different things, kind of low back tightness and inactive glutes, because I kind of do the same test with patients for both of them. So what I do is just kind of feel the low back. Uh, this is one. Can you reach back and kind of feel your back? Just kind of get a feeling of how tight they are. And you want to go right off the spine. It's a little tough, especially if you have shoulder range of motion restrictions. So this one's a little bit tougher to tell yourself. So sometimes you need to ask for help from somebody. I'm just feeling that his muscles are a little extra tight on the right side. So now when we do a hip extension, it should be mostly glutes. But a lot of times when these guys are, either weak or inactive, your low back's going to kick in and help out. So I'm going to have him, so I'm going to touch here and I'm going to touch here. I'm just feeling how, if this one activates and how much this one activates. And I'm going to have him lift his thigh off the table there. And right away I felt this one kick in before this one. So it should be the other way around. This one should kick in. Now I'm going to have him switch and do the left leg. Again, I feel it more here than here, but I am feeling a good contraction in the glutes. So try this one. So it might not be so much of a weakness for him, it just the brain is used to using the low back instead of the glutes for this motion. And what people will notice is they'll have low back pain after they walk more than normal or stand more than normal. So if we were to walk the Mall of America and walk for a few hours, a person might come home and have low back pain or tightness because of that extra steps or walking. They're, the inactive low glutes here, inactive glutes, which is causing the low back to activate and work harder. So now after, try that two more times. Do this side, now do this side, now do this side, and now do this side, and now relax. And now I feel here to see how tight it is. And it's substantially tighter than it was before we did those 6 or 7 leg extensions there. Can you feel back there? Try this side too. Can you feel the difference, how it's tighter? Yeah. So you can still kind of feel it if you're by yourself, but it's a lot easier if you have somebody to help you with this test. So again, this one's checking for low back tightness. You also see this. Let me have you stand up, Kyle. It's generally tight if you look at a person static. So if you have go into an anterior pelvic tilt, and then you get that tension there. So what happens is those hip flexors are tight, pulling your pelvis down, and then nobody walks around like this typically. So then they activate this to tighten up, to keep your head over your shoulders, over your hips, over your ankles. So this will generally be super tight if you have an anterior pelvic tilt. So you can just kind of tell just by a posture check too. And then if these are inactive, the more he walks, the more he's going to use these or activate these instead of these. So these will tighten up because these are a little inactive. So we have exercises on how to activate these. You basically hunch over a table and activate the extension and make sure you're feeling it in the glutes, or a glute bridge where we modify it to make sure that you're kicking in the glutes and not your legs or your abs or your low back.